Traumatic brain injury, TBI, is a complex and potentially devastating condition characterized by damage to the brain resulting from an external force or trauma. This force can be caused by various incidents such as falls, vehicle accidents, sports injuries, assaults, or military combat. TBI encompasses a broad spectrum of injuries, ranging from mild concussions to severe and life-threatening brain trauma. When an external force impacts the head or body, it can cause the brain to move rapidly within the skull, leading to injuries. There are two primary mechanisms through which TBIs occur. Closed head injury. This type of injury occurs when the brain sustains damage without any penetration of the skull. It typically results from sudden acceleration or deceleration forces, such as those experienced in car accidents or sports-related impacts. Closed head injuries can cause a range of damage, including bruising of the brain tissue, contusion, bleeding within the brain, intracerebral hemorrhage, or widespread tearing of nerve fibers, diffuse axonal injury. Penetrating head injury. In this type of injury, an object penetrates the skull and enters the brain tissue. Penetrating injuries can occur due to gunshot wounds, stabbings, or other sharp objects, resulting in localized damage to specific areas of the brain. The symptoms of TBI can vary widely depending on factors such as the severity of the injury, the specific areas of the brain affected, and individual differences in response to injury. Common symptoms may include headaches, confusion or disorientation, memory problems, difficulty concentrating, dizziness or loss of balance, nausea or vomiting, sensory changes such as blurred vision or ringing in the ears, mood swings or changes in behavior, difficulty sleeping, loss of consciousness, which may be brief or prolonged. In mild cases of TBI, such as a concussion, symptoms may be temporary and resolve over time with rest and symptom management. However, moderate to severe TBI can lead to long-term complications, including cognitive deficits, motor impairments, seizures, communication difficulties, and changes in personality or behavior. In some cases, TBI can result in permanent disability or even death. Diagnosing TBI typically involves a comprehensive evaluation, including a physical examination, neurological assessment, and imaging tests such as computed tomography, CT scans, or magnetic resonance imaging, MRI scans. Treatment for TBI focuses on managing symptoms, preventing further injury, and promoting recovery. This may involve medications, rehabilitation therapy, including physical, occupational, and speech therapy, cognitive rehabilitation, and psychological support for both the individual and their family. Preventing TBI involves implementing measures to reduce the risk of accidents and injuries. This includes wearing seatbelts in vehicles, using helmets during sports or recreational activities, practicing workplace safety measures, implementing measures to prevent falls, especially among older adults, and raising awareness about the risks associated with activities that could lead to head injuries. Additionally, educating the public about the importance of early recognition and appropriate management of head injuries is essential for minimizing the impact of TBIs on individuals and communities.